Well, welcome to the MediGroup webinar series. Yes, we're thrilled to have you join us today as we delve into an exciting topic that impacts healthcare professionals in many ways. Our mission is to foster knowledge sharing, collaboration, and innovation within the medical community. Each session brings together experts, thought leaders, and practitioners to explore critical issues, cutting-edge research, and practical solutions. Today's presentation is brought to you by our contracted supplier, MedMira. We have with us Jim Emery, a partner with MedMira. And from their website, MedMira's technology platform and testing solutions are known worldwide for their quality, accuracy, and speed, and their HIV test is the only one in the world to earn the approval of Health Canada, the United States Food and Drug Administration, the European Union, and the China Food and Drug Administration as well. So, ladies and gentlemen, thank you for being part of the MediGroup community. Let's begin. Jim, take it away.
Wonderful. Thank you so much, Frank. I really appreciate it. And as Frank said, my name is Jim Emery, and I'm a partner with MedMira. I'm excited to present the Reveal G4 Rapid HIV 1 and 2 test for the MediGroup partners. As you'll see in this brief presentation, there are several key differences that have evolved, separating us from other tests. I'm excited to get to share more about the company, the platform, and how we can get started. So let's get going. MedMira is rapid testing reinvented. It was founded in 1993 out of a desire to create a diagnostic test that would impact healthcare on a global level. We've developed a rapid vertical flow technology platform, which, as Frank mentioned, is known for its quality, accuracy, speed, and versatility in any setting. It's been approved by health regulators in USA, Canada, Europe, and China, and is the first ever approved by Canada and second in the United States. We're used in major institutions domestically and internationally. What I mean by that is major institutions such as New York Methodist Hospital, Johns Hopkins, the U.S. Department of Defense, U.S. Department of Veterans Affairs, the U.S. Navy, as well as the AIDS Healthcare Foundation, just to name a few. We see with the forces at play that the time is now for change. Economically, the increasing healthcare costs and challenges for providers is at an all-time high. As we look to standardize HIV testing to hopefully reduce those numbers to zero, our aggressive pricing for members will allow for the CTP code to pay for the test. Socially, there's the illusion of safety now. So one of the most recent changes is that people with HIV that take pharmaceutical preventions are no longer contagious if undetected. However, the challenge we've heard from many community groups is that people on these medications sometimes take holidays, or they'll miss medications, which can have harmful consequences. In a CDC study for patients on antiviral suppression medications, MedMira had the highest sensitivity and was able to detect patients after 236 days of treatment, which is fantastic. And with our technology, there's no more risk of false negatives. So MedMira has developed and patented this rapid vertical flow technology that is faster, more accurate, and unlike other rapid tests, doesn't have a chance for false negatives. But we'll dive into that next. So as we can see, we've really separated ourselves from, we can do that too in rapid testing, to one that stands out with unmistakable results and accuracy in a critical time. So here we look at the test itself. You get the physical characteristics, and I'll give a short background, the principles behind it. So traditional lateral flow tests, as shown on the right here, use capillary action to actually pull the specimen and reaction agent across the membrane, similar to like a paper towel absorbing liquid on a counter. Our technology uses a constant, which is gravity, to catch both the specimen and the reactant agent like a bucket catching the rain. And with that, allows our test to be up to 5 times faster than lateral flow. In addition, the challenge with traditional lateral flow technology is that it's susceptible to a phenomenon known as the hook effect, which essentially means that the test can be so overwhelmed by a testing particle that the test line will disappear, creating a false negative. Our test isn't susceptible to this. Also, because of this, it increases our overall specificity and sensitivity in real-world applications. As we look at the principles, a simple diagram here to show you that the specimen is added. It passes through the test membrane, connecting to the control and test zones, and the excess passes through. Then we add our detection agent, where it'll attach to the specimen and gives a highly or a brightly colored and easy to read test and control line. As shown on this next slide, we can see in the illustration that our test clearly distinguishes control from testing area. As highlighted on the graphic below, this shows the difference between a reactive, a non-reactive, and invalid results. In addition, the results are immediate and do not fade away over time, which also sets us apart from other tests. Included in that, our control line will only show up if the steps are done correctly with a human sample. We are the only company with a built-in quality control aspect to protect our patients and providers. Next, I'd like to show a brief video that explains MedMira's RVF technology.
MedMira's patented rapid vertical flow technology is transforming point-of-use testing. It's rapid, accurate, versatile, and needs no refrigeration. Unlike lateral flow, which can take 10 to 40 minutes to deliver a result, MedMira's rapid vertical flow technology uses the law of gravity to accelerate the process, delivering results instantly. When the sample is added to the test cartridge, target material is captured in the test zone on the membrane. In MedMira test, excess sample passes through the test membrane, unlike lateral test, where it can easily overwhelm the detection agents, potentially causing the hook effect and giving false results. After the sample is captured, our instant gold cap goes to work. Universal buffer is added, instantly releasing color detection agents. These detection agents bind to the captured target material, with excess detection agents passing through the membrane. A successful test is completed, showing a bar in the control zone, and a reactive result is shown with a distinct line or dot. A non-reactive result is shown with no line or dot. This innovative technology platform allows the detection of multiple targets with just one drop of specimen on a test cartridge. One test, more answers. MedMira Rapid Vertical Flow Technology. Rapid testing reinvented.
So again, kind of recapping on that video, with the use of the RVF technology, we've created an incredibly easy to use system that can be completed in essentially three steps. Because our test isn't susceptible to that hook effect, it provides us with increased sensitivity and specificity. All of our tests have an 18-month shelf life at room temperature. They do not require refrigeration, which is also unique. Our kits come complete, so all of our customers love the fact that they do not need to purchase additional equipment to use this platform. In addition, MedMira has never been on back order and maintains a supply of 3 to 4 months worth of product ready to go for distribution. So here are some of the specialties that are currently using our testing. So urgent care, family practice, internal medicine, labs, lab centers, OBGYN, freestanding ERs, and correctional health. As we come to discover, there's a tremendous opportunity to add this to standards of care or implement it for your patients. Treatments have come a very long way, but there's still a lot of work to do. Our goal is 0 new infections, but that comes from testing and awareness. What we do know is that patients can get tested, patients that could get tested from the office or a clinical setting and get started on those medications right away, it greatly reduces the risk of spreading and helps the patient live a healthier and more informed life. So what we've come to understand why our customers love us and they seem to not switch is that we have a trusted technology. Our RVF technology is far superior to lateral flow tests. It eliminates the possibility for false negatives, and it gives you that increased sensitivity and specificity. We are used worldwide in some of the most critical areas. Ease of use. This test can be completed in 3 minutes with no additional equipment needed. We found that the customers that start using our testing platform don't switch because of the ease and convenience of use. We are simple to order. In a few slides, we'll show that we've provided an order form for all of the MediGroup members where they can call, fax, or email in their order, and ultimately our training and support. So we have a team of clinical training specialists behind us that can assist with any questions you may have, whether that's developing SOPs or creating a protocol for implementing this into your standard of care. We're here to help you. So making sure that we choose the right format for you. As we've mentioned, we have 3 platforms available for the MediGroup members. We have our POC format, which is finger stick, whole blood, unpackaging to results in less than 3 minutes. Each box contains 20 tests. We have our lab whole blood format, which is for venipuncture. Again, unpackaging to results in less than 2 minutes, and each box contains 50 tests. And then our lab serum and plasma. Also, each box contains 50 tests, and it's unpackaging to results in under 2 minutes. And with the MediGroup order form, how to order, we've provided this form basically to simplify and organize the required information so our members can get the special pricing. All tests, again, are sold by the box. You can feel free to call or fax in this form 1-877-MedMira, or that's 1-877-633-6472. Or you can email us at sales@medmira.com. And additionally, online ordering is available on this website at the link below. So speaking beyond our rapid HIV test, just to know that we do have much more in the pipeline for you, that things that are becoming available. So in addition to our rapid HIV tests, we also have rapid testing for syphilis antibody, as well as hepatitis B and C that are in final stages of clinical trials. And for our laboratory research partners, our technology allows us to customize panels for your needs, and the speed of the RVF has been extremely valuable in batch testing. Again, these products are available for research use only. I want to thank you very much for your time today. I really appreciate the opportunity to present this to you. You can contact us again at 1-877-MedMira or email at sales@medmira.com. For any technical support, we have a product medical info line at 902-450-1588. And if you just want some additional information, you can always go to www.medmira.com or email me at jim.emery@medmira.com. Thank you so much for your time today, and I'll open it up if there are any questions.
Jim, thank you very much. Great presentation. Certainly, MedMira has made it easy for our members to place orders, fax, email, or online, and MedMira matches all of our classes of trade within MediGroup. So we're very happy to be contracted with you for our members. I don't see any questions in the chat box, but this has been recorded and all of our members will get a copy. And I'm certain that you've got all your contact information in there. So I am certain our members will reach out and ask questions or place orders. So we're excited to be contracted with you, Jim. Great presentation and appreciate your time. Thank you very much.
Thanks so much, Frank. Thank you, Allison. Have a wonderful day.
You too. Thanks a lot. I appreciate it, Jim. Take care. We'll talk to you soon.
Take care. Bye-bye.
You too. Bye-bye.